All right. Good afternoon, everybody, and welcome to Cook County Health's Facebook Live on Healthy Hearts. February is Heart Month, which is a great time to discuss heart disease, which is the leading cause of death in the U.S. Here at Cook County Health, we are proud to have been recognized by U.S. News and World Report as a high performing organization in the care of heart failure and heart attack, as well as the American Heart Association's 2023 Get With the Guidelines Heart Failure Gold Plus Award. I am honored to be joined here by a few members of our cardiology team who are here to discuss just a few aspects of cardiac care. I'm going to let them introduce themselves in a moment. But first, this is a live discussion. If you have any questions about heart health, feel free to type them below. Now to our experts. If everyone can introduce themselves and talk about your area of expertise. Dr. Brock, let's start with you.
Oh, sure. I'm Max Brock. I'm one of the general cardiologists here. So that's a short way of saying that I focus on cardiology in a non-invasive way. So things like diagnosing issues with the heart, treating things with the heart, and working through it. I'm one of the other cardiologists similar to Dr. Totleben and Dr. Kolzar here, also focused on imaging of the heart. And we see patients both in the hospital and outside the hospital.
All right. And how about Dr. Golzar?
Yes, my name is Yasmin Golzar. I'm also one of the non-invasive cardiologists here at Cook County Health. I've been here for 12 years. I'm the director of the Echo Lab. And my particular area of interest is, again, imaging the heart in different ways, particularly using ultrasound, which is called echocardiography. Dr. Totleben and I also have a clinic where we care for patients with cardiovascular disease who also have HIV. And an overarching interest of mine is looking at healthcare disparities in the United States.
And last but not least, Dr. Totleben.
Hello, I'm John Totleben. I'm a non-invasive cardiologist at Cook County. I've been at Cook County, I think, for 5 years now. I did my training at Rush for medical school, residency, and fellowship, and then came here. I specialize in cardiac imaging, like Dr. Brock and Dr. Golzar. I do cardiac CT scans, cardiac MRI, echocardiography, and nuclear cardiology. And I see patients in the cardiac intensive care unit, in the clinic in Blue Island, and the clinic at Stroger.
Great. So this is a question for everybody. Why did you choose to work in the field of cardiology? There's a lot of different ways you could go in medicine. Why cardiology?
I think we should let ladies first. What do you think, Dr. Brock?
That sounds perfect.
Because it's the best. I mean, cardiology is, it is really, every day is variable. So all of us see patients in the outpatient clinic, but we also see patients in the ICU. We do procedures. We're caring for very ill patients in the acute setting, and then we get a chance to take care of patients and have long-term relationships with them, which I think is really satisfying to see patients throughout their disease course. Things are changing in cardiology all the time, and I think it's exciting and it keeps us on our toes, and we're always learning. So, for me, those are some of the reasons why I chose to be a cardiologist.
I'll go ahead next. I like the full spectrum of disease. I think you spend a lot of time, preventing disease. You can even do things like sports cardiology, and there's different niches of cardiology before you even have clinical disease. And then we take care of a lot of patients who've had large heart attacks or have a weak heart or abnormal heart rhythms of their heart. And then to the opposite end of the spectrum, where patients are near the end of their life and figuring out how to make sure that our care aligns with their goals too. So we can see patients at all spectrums in their life and through their disease process, and making sure that we are excellent physicians throughout that entire process is something that I really cherish.
I'd echo both of those sentiments. I think that's well said. For me, there's two particular aspects of cardiology that I find most rewarding. The first is that cardiology is a field that has a large evidence base behind it. We've got hundreds and hundreds of clinical trials showing us which blood pressure drugs work best for which specific condition, which treatments work best for heart attacks and heart failure and valve disease. And this allows us to tailor medicine to the individual needs of each particular patient. There's a great degree of fulfillment in providing evidence-based care for patients. And also, there's a great degree of fulfillment in providing care to a lot of patients. Heart disease is the #1 killer of Americans. And when you practice a part of medicine that allows you to apply your skills to a broad patient population, we know we're doing both clinical medicine and, to a degree, some public health service. And the fact that cardiology touches so many people living in our country and worldwide is a particularly motivating factor for me.
Great, absolutely. You just mentioned the fact that heart disease is the number one cause of death in the US. Dr. Brock, can you talk about some of the underlying causes of heart disease? And is there anything people may not connect or immediately recognize as putting them at risk?
We, as Dr. Gottlieb said, we have a lot of evidence. So, I view preventing heart disease as, trying to stack the odds in your favor. So, if you try to have a variety of different things that we know are the main causes of heart disease and try to keep those either not present in your life or controlled, I think that you are, doing your best to prevent it as possible. So those things are high blood pressure, high cholesterol, sugars, and diabetes. Family history is something we can't control, but we can be cognizant of, and then staying active. And so that's the one thing that I try to as doctors, we're always focusing on the blood pressure and cholesterol, either in the background or in the conversation with the patient. But I think exercise and staying active is something that I try to focus on a lot in my visit because sometimes it's unclear exactly how long or how far to exercise. So my approach is to simplify it as much as possible. Our current guidelines say 150 minutes, and that can be a little bit hard. Is that 2.5 hours? Do I have to count my minutes from yesterday or the next day? So my advice to patients is just to try to stay active every single day, and a type of activity where you would break a sweat. You don't need to run a marathon, you don't need to start swimming tomorrow, but you should be able to, try to exercise a little bit every day where you have a little bit of, with a little heart to have a conversation with your workout partner. So if that's power walking with your neighbor or going on a quick bike ride or whatever is enjoyable to you, I think if you prioritize that and aim for every day, and if you fall a little short and do it 5 out of 7 days, I think you've done a really big service to your health.
That's a good suggestion. When you said 150 minutes, are you talking per week or are we doing 150 minutes a day?
Oh, no, thanks for clarifying. Yeah, 150 minutes per week is our current society guidelines recommendations. And that's and that can be spread over the week. But again, sometimes that's a little challenging to think about in total minutes per week because that's not how we often think. So I think aiming for every day and aiming for moderate activity where you get a little breathy when you exercise is the goal that I try to give to all people.
You mentioned family history. When we're looking at our own family's history, how far back or what is the kind of connection between that and heart disease? Do I need to look at, my great aunt, 3 times removed, or are we looking at, 2 generations?
I think the key is to look for unexplained death at younger ages, especially. We start to think of people under 65 or under 55 as higher risk. So if you have a great grandfather who died of a heart attack when he was 90 and had a lot of traditional risk factors, that's something that we would not put you at elevated risk compared to the average population. So start with first degree relatives, which are in a medical way of saying your parents and your siblings, and we can always take a detailed family history to see if you're at higher risk than others. But I think starting closer to your family is usually where I would start before I would branch out to more distant relatives.
Great. Dr. Tolibin, I'm sure for many people, visiting a cardiologist for the first time can be kind of scary. Can you walk us through what is a first-time visit with a patient? What should they know and expect? What information do you hope they bring to that appointment? And how do you try to help them going forward?
Sure. So one of the first things people should expect when they come to see a cardiologist is that they'll probably get an EKG. With an EKG, we put tiny little stickers over the front of the chest directly on the skin, and that gives us really valuable information about the heart rate, the heart rhythm, and potentially if the heart has suffered any previous damage in the past. This is a routine thing to expect when visiting a cardiologist. You can also expect that the cardiologist is going to ask you really detailed and careful questions about if you have chest pain, if you're lightheaded, if you feel short of breath, and how much exercise you can sustain. As Dr. Brock is saying, we want everyone to be active. And if someone is having symptoms when they're active, such as breathlessness, chest pain, or lightheadedness, that's a concern to a cardiologist that there could be underlying cardiac disease. So we want to zero in on that, and we want to understand exactly what's causing those symptoms. We also ask a lot of careful questions about family history, about smoking and personal habits. We don't mean to be rude. We just want to get down to the bottom of the problem. We want to know exactly what medications you've been taking and for how long, if you have allergies, and if you have other medical conditions that may affect your heart, such as high cholesterol, diabetes, or high blood pressure. So when you see a cardiologist, we'll ask you a lot of questions. We don't mean to be nosy, but we want to get a good understanding of exactly what's going on inside your heart. When we have that understanding and our EKG, hopefully we can provide some insight into what may be giving you any symptoms, and then recommend proper testing. Tests we often use include stress tests, where we give exercise or medicine to simulate the effects of exercise to watch how the heart responds to that stress. Ultrasound of the heart, which Dr. Golzar mentioned, we call echocardiography, or a heart monitor. This collects all of your heartbeats and lets us know if you have any problems with the electricity or the rhythm inside your heart. Hopefully, when we get that testing back, we can let you know if your symptoms may be coming from your heart or potentially someplace else.
Great. That's good information to know. Dr. Golzar, let's talk about heart disease in women. What do women in particular need to know about heart disease, including the symptoms of a heart attack?
Yeah, so in the United States, heart disease is a leading cause of death in women. So I think it's really important that we take that seriously and understand that women may not present in the typical way that that men may present, or that we've been taught, what we call textbook, textbook presentations. So a lot of times women their symptoms may be a little bit more subtle. They may not have the crushing chest pain that we have been taught is associated with a heart attack. They may have epigastric pain, so just pain in their abdomen. They may have shoulder, neck, or jaw pain, extreme fatigue, or nausea or vomiting. So that makes it a little bit more nuanced, and it's really important. I think in the cardiology community, we are becoming more and more aware of the vulnerability that women have of heart disease and the fact that they may not present in typical ways, and making sure that women know when to seek care. So I would say be accustomed to knowing what your body feels like, and if things seem like you don't feel the way you normally do, your ability to walk is or exert yourself is limited by any of these symptoms, or you have a sudden change in symptoms, then seek medical care.
That's very informative. Dr. Brock, can you talk about some of the things that Cook County Health does to help our patients who are at risk for cardiac issues or who are recovering from them?
Yeah, of course. So I think prevention is the key that we're always trying to focus on, and that often starts before the patients reach us. So our primary care here at Cook County is excellent. They are focusing on a lot of the risk factors for coronary disease or for a weak heart that could lead to heart disease down the road. And so a lot of the wonderful things that we do for cardiovascular care happens before we even meet the patient. So, I would really want to use this as an opportunity to really highlight our wonderful, wonderful primary care centers, both in Stroger and a lot of our community health centers that some of us also see patients at too. Also, Dr. Golzar, Dr. Talib, and myself, we can know the perfect medicine for patients and, figure out, this is what they need for their heart. But a lot of times that's not, a patient's number one issue. Sometimes it's food security or housing or other, social determinants of health that really play a large role into their health. And so, knowing what patient someone should take for their weak heart is wonderful, but it's not wonderful for the patient if they can't afford it, if they're worrying about what they're going to have for dinner the next day. So I think Cook County Health has a lot of different initiatives that they are focusing on besides just the medicine that all of us practice, and those include the Fresh Truck, which is something that they partner with Chicago Food Depository to make sure that there are different locations in Chicago where our patients have access to fresh food, and some other wonderful initiatives that happen both at Cook County Stroger Hospital, but also in our community health centers, around Chicagoland area.
And it's important that patients feel like if they have concerns about, their care, that they talk to the doctors, right?
Oh, absolutely. We want to hear their medical concerns, but also stress and life and, all concerns that affect our patients, are concerns for us, and making sure that we can tailor our recommendations, both from a medical and a social aspect, to make sure that, all of our goals align.
Great. Dr. Golzar, if someone's put on a medication for cardiac issues, is that something they're going to be on for the rest of their life?
It really depends on what we're treating. So there's certain conditions that have um, a certain finite time course for medications. For instance, if you have a blood clot in the heart or a blood clot in the lung, there's a certain duration of treatment, and after that, reevaluate you and generally adjust your medications after a certain period of time of treatment. That's true also for certain heart procedures. We do structural cases here at Stroger where we're closing holes in the heart or placing stents in the heart and sometimes or treating abnormal heart rhythms. And your medications may be different immediately after a procedure for several months and may be adjusted after that time. So for certain procedures and certain conditions, it's going to be a finite time course. For other chronic diseases, such as heart failure or a weak heart, those treatments do require an indefinite course of medications. And I think a lot of times what I try to let patients know is, with every visit, particularly with heart failure, we try to optimize their medical care and their medications. And sometimes that means increasing the doses of medications or adding on more medications. And I think a lot of patients feel really dejected when we increase doses of medicines or add on new medications. When your cardiologist is doing that, it generally means that that's a great opportunity to improve your symptoms and improve your outcomes. So medications for certain chronic conditions, sometimes it does require higher doses and more medications. And I just want patients to know that that does not necessarily mean that that's a bad thing or that you're not doing well. Another thing I want to say is that no matter what medications you're on that your cardiologist has put you on, it's really important that you continue them and don't stop them until you've spoken to your cardiologist. So just make sure if you're not tolerating something or you have concerns about something that you don't stop it immediately. You speak to your cardiologist before stopping any medications.
Absolutely. Dr. Totleben, I'm sure there are people out there who don't know that they have heart disease. When is it time to talk to your doctor about heart symptoms you may be experiencing or concerns you might have?
Yeah, that's a really important question, Kate. One of the things we're always on the lookout for is chest pain. We like to know if someone's having chest pain, and we ask a lot of questions about chest pain. Does it happen when you walk? Does it happen when you're at rest? Does it cause you to feel short of breath? We ask more questions about chest pain than you thought you could think of, than you can even imagine. This is so important because if someone has coronary artery disease, oftentimes the first sensation they feel is a chest discomfort, a chest tightness, a chest pain. We always want to make sure we understand that. If you're having chest pain, that's a reason to talk to your cardiologist. Another symptom we are on the lookout for is shortness of breath. If you used to be able to walk 2 blocks and you felt fine doing so, and now you feel short of breath with that activity, we want to understand if that's from a weak heart, if that's from a problem with one of your heart valves, or something else. We also want to know if you're feeling dizzy, lightheaded, or, God forbid, if you faint. Sometimes fainting can be an indication there's an underlying heart problem. If you have any of those symptoms, we'd like to know about it, and chances are you'll find yourself answering a lot of questions about those symptoms because we really want to get down to what's causing your discomfort, and we want to help you feel better.
When is when you're talking about chest pain or some of the symptoms that you were talking about, when should you wait and talk to your primary care doctor, or when is it time to call 911 or go to the emergency room?
That's another great question. So I think the short answer is probably if you're having new severe symptoms, you don't want to wait. If you didn't used to have any chest pain and now you're getting chest pain walking up one flight of stairs and that's new to you, you want to go in right away to the emergency room and have someone evaluate that. If you faint suddenly, you were healthy a few days ago, and now all of a sudden you've fainted, you've lost consciousness, you fell out, you've blacked out, and there's not an explanation for that, you need to see a doctor right away in the emergency room. Shortness of breath often is more subtle, at least in the world of cardiology. It begins gradually and can get worse over time. You may be able to wait that out and talk to your primary care doctor as long as it's slowly worsening over time. If it's sudden and severe, regardless of what it is, you should come to the emergency room.
And you all touched on chest pain. I think sometimes people might not know what exactly should I be looking for. Is it, the elephant on the chest? Is it, the tightness, or is it all of the above?
Yeah. Some people, as Dr. Golzar mentioned, have a very classic combination of symptoms where they feel a chest tightness or squeezing that comes on with exercise and goes away when they stop exercising. And with exercise, I don't mean running a marathon as Dr. Brock does. I just mean walking down the street. If you're walking down the street and you feel new chest pain that feels like pressure, sometimes that can indicate coronary artery disease, which is something a lot of cardiologists are thinking about. But as Dr. Golzar mentioned, it's not always classic. Some people feel a shortness of breath or a nausea, a less common symptom, and that often happens in people with diabetes and women. So we're on the lookout for that too. I think that answers your question. I'm not entirely sure if I got to it.
Very good. This is the last question, and it's for everybody in the group. We'll start with Dr. Brock. What is one thing you hope people take away from this discussion today, or one thing that you encourage your patients to do to kind of have healthy hearts or maintain or improve their heart health?
I think it's human nature sometimes to compartmentalize things. So, you're at this stage in your life, you're going to school, and this stage of your life, you're working, and then you're going to retire. And I think a lot of people like to think about focusing on their health and their prevention, later on in their life when they're older and when they're more likely to have disease and retirement. And I try to encourage the opposite, because it's not only if you develop these risk factors for heart disease, develop high blood pressure, high cholesterol, or diabetes, but often it's how long you've had them. So I think the sooner you can focus on your health and wellness and prevention, the better service you're going to do for yourself in preventing diseases, not only 10 years on the road, but 20, 30, 40 years. You can help prevent some of the diseases that we commonly see. And no matter where you are in the process, we're here to help you with your journey.
Dr. Golzar?
I always tell my patients, I think it's important that lifestyle changes, to recognize that lifestyle changes don't have to be extreme. Small changes can make a big impact. So even if it means just eating more plant-based foods on your plate with every meal, or incorporating doing stairs rather than taking the elevator, even those small changes can make a big impact. And just leading a balanced life is really important. We know more and more that low levels of exercise throughout the day is really beneficial. And being connected to your community, to your family, to your friends is not only an important source of support, but is a great, an ingredient when it comes to having joy in your life, but also having great outcomes, even when you do have cardiovascular disease.
I think you guys took my answers, since you guys talked about all the good stuff. Let me talk about blood pressure. Blood pressure is a silent killer, and it makes a difference if you get control of your blood pressure early in life and if you stay on top of it for many years. Blood pressure or hypertension is something that touches many people. And if it doesn't touch you, congratulations, but it likely will touch someone in your family. And understanding your blood pressure is simple. You can check it at Walgreens, at CVS, at a commercial grocery store. You can buy a cuff on Amazon for about $30. And making sure your blood pressure is between 120 on the top number and 140 on the top number, 120 to 140 on the top number, or the systolic blood pressure. Making sure your blood pressure is within that range is an important step you can prevent heart disease.
Those are great answers. So I'd like to thank our physicians for taking time today out of their busy schedules to discuss healthy hearts with us. If you want to learn more about our cardiology team, visit our website at cookcountyhealth.org, or to make an appointment, call 312-864-0200. Thank you and happy Heart Month, and stay healthy, everybody.
Thanks, Kate.
Yeah, thank you.